When we talk to families about what to expect across the dementia journey, many times the amount and the detail of information I give is very much based on their interest level. And I actually begin the question by saying, some people want to know everything. They're very big planners and they want to know all of the things ahead. Some people really just want to know what's around the corner. Where would you put yourself in between those two extremes? And I let that discussion then be guided by the family care partners. Typically, my preference is to look at the next 6 or 12 months because it can be very overwhelming to take in the entire journey. So many things can happen. And again, people don't just have dementia most of the time. 95% of my patients have other chronic conditions and things that can also affect what happens to them in the next year. So I call this anticipatory guidance. That is actually a phrase that I stole from pediatrics. When I take my children in for their well checks, what do you get? You get a handout that says, this is what most 6-year-olds are doing. These are things that you might look out for over the next year. And then I, as a parent, can consider how I might want to approach or respond to those things if and when they happen. Dementia follows fairly well-worn trajectories. They're fairly typical and we know what to expect as a clinician. My goal as a primary care clinician for people living with dementia is that if I'm not surprised what is about to happen, I don't want the family care partner to be surprised. So we're going to talk about what might happen in as much detail as they're comfortable understanding. It doesn't mean they have to make a decision about it today. So if I'm concerned about wandering while driving over the next 6 months, it doesn't mean that today we have to decide we're no longer driving or that we only drive on surface streets and no interstates. We have a lot of gradients along that conversation and decision making along the way. And then we can also talk about what would trigger this decision. When would it be time to have a conversation? And is it a conversation or is it a family meeting? And many times that anticipating changes, honestly, I think that is one of the things that minimizes the crisis. Certainly avoids things like an emergency department visit when symptoms arise that they knew were probably coming. So I don't give out a sheet, but I do. My team is actually building some illustrations right now for caregiver resources because there's nothing out there that is helpful for us. If there are sheets about what to expect, first of all, they're very big picture. And they're all about Alzheimer's disease. And some people have frontotemporal disease and Lewy body disease. We have all comers. So we've been building out, we did the basic work to build the illustration, and I have a graphic designer who's working with us to make that a one-page resource. Sometimes it's helpful, right? Because even if it is even if you looked at the whole journey and you said, these are the symptoms that will appear, these are the ones that typically appear earlier, maybe later, people can sort of identify themselves somewhere on that map and then, okay, this is where I am today. What's probably next? What should I be looking out for? It's been really helpful, again, for planners. People living with dementia, typically older, they're often being supported by families. These people did not just meet. They have well-worn patterns of how they interact with one another and how they behave. So some people, big planners, they want to look ahead, they want to know what's coming, they want to put like safeguards in place early on. Probably more people are waiting for something to happen. Hopefully it's a mini crisis, not a major crisis. And they're like, okay, now it's time to have this response. So it really depends on their risk tolerance, honestly, what they're willing to do ahead of time and what they'll just wait for. So I think the people who are the planners, they want to see where they are and what's coming.